The idea that our gut microbes may influence cancer risk and treatment outcomes has shifted from fringe speculation to a serious area of research. The gut microbiome, composed of trillions of bacteria, viruses, fungi, and other microorganisms, plays a crucial role in regulating immune function, inflammation, hormone metabolism, and even gene expression. These are all key pathways in cancer biology. As such, the notion that diet can shape the microbiome and, by extension, alter cancer susceptibility or therapeutic efficacy is an enticing one. Yet, while emerging evidence supports the microbiome's influence, translating this knowledge into practical dietary strategies remains complex, uncertain, and not without potential dangers when misunderstood. One of the most compelling findings is that a diverse, fiber-rich diet can support a healthier, more resilient gut microbiome. Dietary fibers, particularly from whole plant foods, are fermented by intestinal bacteria into short-chain fatty acids like butyrate, acetate, and propionate. These compounds exhibit anti-inflammatory effects, support the integrity of the gut lining, and may even have anti-proliferative effects on cancer cells, especially in the colon. Butyrate, in particular, has been shown to inhibit histone deacetylases, DACs, and induce apoptosis in colorectal cancer models. On the other hand, low-fiber, high-fat Western-style diets tend to reduce microbial diversity and promote the expansion of pro-inflammatory species, which may encourage tumorigenesis through chronic immune activation, genotoxin production, or bile acid dysregulation. Several studies now suggest that the composition of the gut microbiome may help predict a patient's response to certain cancer therapies, especially immunotherapy. In melanoma patients treated with checkpoint inhibitors, for example, the presence of specific bacterial taxa like Faecalibacterium prosnitzii and Akkermansia mucinifila has been associated with better treatment response and fewer side effects. Antibiotic use, which can disrupt the microbiome, has been linked to poor outcomes in some cases. These associations are biologically plausible, but not yet fully understood. Moreover, attempts to replicate these findings across different patient populations and cancer types have produced mixed results, and the mechanisms by which microbes modulate immune checkpoint activity remain under investigation. The enthusiasm surrounding gut healing diets, probiotics, and fermented foods has exploded in parallel, but much of this is ahead of the evidence. While fermented foods like yogurt, kimchi, sauerkraut, and kefir contain live microbes that may offer benefits, their specific effects on the microbiome are highly individualized. Not all fermented foods are created equal, and many store-bought versions are pasteurized or contain limited strains. Commercial probiotics, capsules of isolated bacterial strains, are widely consumed, but their effectiveness in altering the microbiome or improving cancer outcomes is unproven and may even be counterproductive in some cases. Some research suggests that taking generic probiotics after antibiotic exposure may delay microbiome recovery compared to doing nothing or using an autologous fecal transplant. There is also growing concern about oversimplifying the link between microbiome and cancer. The microbiome is not a monolithic entity, and its composition is influenced by far more than diet alone. Genetics, medication use, environment, infections, and early life exposures all play critical roles. Moreover, causality is notoriously difficult to establish. For example, is a disrupted microbiome driving cancer, or is cancer, or its treatment, disrupting the microbiome? Many studies are correlational, and microbial profiles may reflect underlying disease states rather than cause them. Efforts to define a healthy microbiome are also complicated by the fact that microbial diversity varies significantly between individuals and populations. Another emerging challenge is the marketing of personalized microbiome testing kits that claim to tailor dietary advice to a person's gut profile. These tests often lack clinical validation, and their recommendations are rarely based on solid evidence. Patients may be encouraged to follow restrictive, expensive, or unnecessary diets based on unverified data. This can distract from more fundamental and broadly supported dietary principles, eating a varied, plant-forward diet with sufficient fiber, minimizing ultra-processed foods, and supporting overall metabolic health. For cancer patients in active treatment, caution is especially warranted. Drastic dietary changes or unproven supplement use can interfere with therapy, contribute to malnutrition, or cause distress. Interventions aimed at the microbiome, such as fiber loading, high doses of fermented foods, or self-prescribed probiotics, should be discussed with a clinical nutritionist or oncologist to avoid unintended consequences. In some cases, such as bone marrow transplant or chemotherapy-induced neutropenia, certain foods may even be contraindicated due to infection risk. In short, the gut microbiome holds enormous potential as a modifiable factor in cancer risk and care, but the science is still evolving. There is clear evidence that a diet high in diverse, fiber-rich plant foods supports microbial health and may offer protective effects against some cancers, particularly of the digestive tract. However, manipulating the microbiome in a targeted, reliable way remains out of reach. Until research catches up with the hype, the most prudent strategy is to focus on sustainable, evidence-based dietary patterns rather than isolated superfoods or microbial fads. The microbes in your gut may be powerful allies, but they are not magic bullets.